There's a lot of efforts to try to attract, and whether it's urban or rural Colorado, attracting qualified medical professionals at any level is a challenge.
In many places in rural Colorado, you'll drive 100 miles before you can find the nearest doctor's office. We need to make sure that those areas have access to affordable health care. And part of that is making sure that we have the supply of doctors to provide it.
There are some communities that actually fly their doctors in 1 or 2 days a week, which is great that they can have some, in some cases, some specialty doctors. But if you need something right now and you got to wait till the doctor flies in, that really creates a challenge. If you're a doc in a rural community, you're a 24/7 doc, as opposed to a doctor in an urban community where you get somebody on call and you can kind of walk away from it. I think most of your doctors that truly practice in rural Colorado understand that what makes them such an important part of their fabric.
I think a strong medical and physician presence is really important in terms of being able to build a sustainable community. When people look at where they want to live, not only do they look at schools, but they look at access to healthcare. How close do I live to my doctor's office?
The question is if there are enough healthcare providers in rural Colorado to serve the people who are out there. I think in some areas, maybe there are in the resort areas. In our truly rural areas, no, I don't think there are. Hence the reason to focus on healthcare as an employment sector, to train, ideally to encourage those youth that are growing up that they might want to come back and practice medicine, whether it's in nursing or actually as a physician in their own community. There are some significant challenges and barriers in order to meeting the needs of healthcare professionals. And it's important that we create an environment that minimizes those barriers to a successful practice in rural Colorado.